Ladies and gentlemen, remember tonight this is Urology Health Review. We're talking to Dr. Gousse, asking him questions about his researches. And also I have with me here Erica talking to Dr. Gousse. Dr. Gousse, this is such a nice show and we have more to come for you. I know, Erica, before the break you wanted to ask some questions. So.
Yes, after your residency program, Dr. Gousse, I know that you went on to a fellowship program, and you studied, of course, urology and the subspecialty of female reconstructive surgery. Can you explain a little bit to the audience about the subspecialty work and how you're one step higher, per se?
Well, thank you. Yeah, that's a very interesting question. Yeah, it's true that I did 6 years of urology. So after medical school, I had to train for 6 years to become a urologist, 2 years of general surgery and 4 years as in urology. But after that, actually, I did 2 what is called fellowships. The fellowships are subspecialty training, extra training after you are a urologist. And one of them was actually in female pelvic medicine and reconstructive surgery. And that one was at the University of California, Los Angeles at UCLA, where I had the great privilege of working with a doctor who's extremely famous called Dr. Shlomo Raz. And he is considered the father of the field in the United States. It's widely understood. Many of the operations that we currently use were devised by him, and I was his student. And we developed a great relationship. And he really taught me the art of what I call transvaginal surgery and the art of reconstruction of the lower urinary tract of men and women, and also understanding in great detail the clinical applications, evaluations, and treatment of any form of urinary dysfunction related to voiding. So that was a very interesting experience. It was a 1-year experience at UCLA. And after that, I was recruited because of that special training at the University of Miami School of Medicine, because that particular residency program did not have female urology and reconstructive urology at that level, so they wanted to introduce it in the program. And at the same time, I was offered the opportunity to mentor and to become the director of the residency training program. So my task was not only to develop the field of female urology and reconstructive surgery, but also to develop, to improve upon the residency training program. And that was a tremendous opportunity, a tremendous challenge, and great gratification, because in reality, over the past 12 years I was there, I had the opportunity of training, I would say, about 36 residents. Many of them are currently serving the community and practicing in South Florida, and many of them have become extremely well accomplished and very well respected, and some of them extremely famous. So I'm very proud of all my residents. In addition to that, I was tasked to start a female urology, reconstructive urology fellowship at the University of Miami, which was the first time they ever had such a program. So I started it, and since then I have trained, each year I have chosen one fellow to train and to develop as a future expert in the field. And so far I've trained 14 fellows. And all 14 of them extremely successful on their own rights and have made numerous contributions to the field and to the subspecialty itself. So those things for me are great accomplishments that I feel very good about, in addition to, of course, seeing patients and helping patients get better and improving their quality of life.
Very good.
Go ahead.
And you also lecture around the world, I understand. You've traveled and given some presentations?
Yes, yes. Well, you know, when you are in academics, you know, having been, when I was, you know, at the University of Miami full-time, you know, I rose through the rank and became what is called a tenured professor of urology. When you're a tenured full professor, when you're a full professor, that's a very high level. But when you're a tenured professor, it's like, it's the maximum level that you can reach from an academic rank, actually. That's the ultimate. And when I had reached that rank, then you start getting many invitations to write textbook chapters, to be a reviewer in journals, which I'm currently a reviewer in at least 5 different medical journals, where I'm an editor and a reviewer for those medical, meaning I judge which articles should be published. In addition, I've written numerous book chapters. And of course, you get invited as a lecturer throughout the world because people want to know how you do things and what are your ideas, what are your thoughts, and what has been your experience, particularly when you do certain complicated surgeries which are rarely performed and you do them at high volume. So people want to see your outcome, they want to see your technique, they want to see your videos, they want to get to understand how you do it. So because of all these things and my involvement in many clinical trials also, I've been involved in what is called clinical trials to investigate new medications, new techniques. So this gives you really, opens the door to travel worldwide to present data, to collaborate with other researchers at a global level.
Talking about international, Dr. Gousse, I saw that you're taking part of many international meetings in urology. You've been going almost everywhere, from one continent to another. Talk to us about that.
Well, it's been a great experience because it gave me a great opportunity to travel around the world and meet different people, meet different scientists of different background, different ethnic background, different racial background, from Asia to Europe to South America to the Caribbean to Central America. And one of the great opportunities I had, having been born in Haiti and being a native Creole and French speaker, I was privileged to have been the keynote speaker at the 100th anniversary, the century of l'Association Française d'Urologie in Paris, where they had their 100th anniversary, and the American Urologic Association offered me as a gift to them so I could be their keynote speaker and talked about various topics in urology. And I was very happy that the reception there was extremely warm. I was very well received with the delegation there, and it was a great experience because I had an opportunity to present in Paris urology for the first time in French. So I actually did the presentation in French, which is one of the rare opportunities I have when I travel worldwide to speak French, because as you know, most countries, the scientific presentations are done in English.
Dr. Gousse, after all these researches that you take part or you did or you lead, is there a trace, books, documentary that you put together so your fellows, the people that are coming after you, the youngsters, could have opportunity to read books anywhere?
Well, yeah, I have written many book chapters. Not necessarily books. I've been asked to write chapters in textbooks, which is a great honor when you ask to write chapters in textbook. I've written in avoiding dysfunction and neurourology, which, by the way, I specialize also a lot in neurourology, where I learned that at UCLA. So I have some background in neurology and in urology. So I treat patients who developed urologic problems because of, neurologic conditions. So I publish, approximately 100 peer-reviewed articles. So these articles are there in PubMed. Anybody can look at them online. If you go PubMed and then you put Gousse, you'll see all the articles that I've written, and people can reference them, and they have referenced them at many other chapters, many other meetings. They reference my articles all the time. In fact, I get an email each time they reference them. And it's very gratifying to see that the work is being done, is being read by others, and hopefully increasing the knowledge in the field.
We're going to take another break, and then stay tuned. We'll be right back.